Hello everyone, this is Pooja and welcome to our channel LoveAndWe. In today's video, I'm going to talk about the postpartum care. So this video will include what is postpartum and the changes that happen during the postpartum and how we deal with them. So let's get into the topic. This topic is all about the postpartum care. So first of all, we need to know what is postpartum. So basically, postpartum is a time period that starts immediately after the delivery of the baby till 6 weeks after the delivery. So this is the 6 time periods where all the changes that happen during the pregnancy and all the reproductive tracts that get back into the normal pre-pregnant states. As we know that a lot of changes that happen during the pregnancy, but it doesn't stop even after the delivery of the baby. So there is a lot of changes that happen after the delivery of the baby that is called the postpartum changes. Now we're going to talk about all the changes that happen to our body. Number one changes that happen to our body is pain, or we can call it contraction or after pain. I used to think that after the delivery of the baby, the contraction will totally gone, but that's not true because I get the epidural at the time of my contractions before the delivery, so that's why I didn't feel any contraction at that time. But after the delivery of the baby, the effect of the epidural was all gone and now I started feeling the contraction. So in this phase, the uterus continued to contract because throughout the pregnancy, the uterus size was increased from lemon to the watermelon size because the baby has to be inside the uterus. So it was stretched from lemon to the watermelon. So now in this postpartum period, the uterus have to shrink and get back to its non-pregnant state. So uterus continue to contract, to shrink and get back to the normal position. That's why we feel the contraction even after the delivery of the baby. This pain feel like a menstrual cramp. So this is same as a menstrual cramp, and this pain lasts from 7 to 10 days after the delivery of the baby. About the pain, now the question is how we ease that pain. The various things to ease the pain. So number one is breathing and relaxation technique. In these techniques, we just do the like a deep breath and just relax. So we just need to continue this process. Try to take a deep breath and relax. And the second one is try to keep your bladder empty. So as your bladder is full or the bladder is distended, it's gonna put pressure on your uterus that's gonna feel you the pain. So try to empty the bladder as much as you can. And third one is ambulation. Try to work as much as you can. Don't put a lot of pressure. You can just start the work for like around the room or just like a small work so that your body will heal quickly. The fourth technique to ease the pain is frequent breastfeeding. So try to start your breastfeeding immediately after the birth of the baby, because once you start the breastfeeding, it's gonna release the hormone that will help to contract the uterus and get back to its normal size more quickly, and it also helps to reduce in the postpartum bleeding. If a pain is even continue even after trying all of these comfort measures, you can have over-the-counter pain medication or you can talk to your doctor. So we just talk about the pain and how to deal with the pain. So now we will talk about the another changes that happen to our body. So that is vaginal soreness. A lot of the women, she experience a vaginal tear or lacerations or some kind of incision that we call the episiotomy that we have to face during the birth of the delivery, because our birth canal is so small, so it have to be stretched, and at that time we will get the vaginal tear or lacerations, or some doctor will prefer to do the episiotomy that we call the incision that made in the vagina. Once you have a tear or the lacerations, the doctor gonna do the stitches on your tear or the lacerations. So even me, I experienced a 2nd degree vaginal tear and I ended off with a lot of stitches. So you will get the sores in that stitch size or in the vaginal area, that is called the vaginal soreness. Because of all that stitches and the tear and laceration, you will feel pain for like few weeks, and it basically depends on how long each your laceration or tear. So some people experience just a laceration, some will end up with a 1st degree, 2nd degree and 3rd degree tear. So the healness is depend on the size of your lacerations and tear. Now the question is how to ease the vaginal soreness. Number one is you can apply the ice pack. So you guys know that we gonna have a bleeding after the delivery, so we have to put the pads on, and here is the ice pad that I use. This is the Freedom ice pack that I got from the Amazon. So you can just open it and you can feel the ice pack and you can put the ice pack underneath your pad. and you're gonna feel that cooling effects. So what happened to me is like after the delivery, so my epidural effect was all gone, and after that I started feeling pain because I ended up with a lot of stitches. So I was having a pain and the burning sensation on that stitch area. So my nurse gave me this ice pack and the pad. So once I applied this one, it provides it is like a heaven. So it provides that cooling effects. It's gonna help you in the pain. So the another one is you can also apply this witch hazel. This is a cooling pad. I'll show you. So this is kind of a cotton pads, but it have that cooling effect. So you can apply this one overneath the pad, and it's gonna give you that cooling effect, and it helps you to ease the pain. So this is just like a pads, and you can just put this one overneath the pad. You can use the several multiple ones. The another product that gonna help you to ease the vaginal soreness is this Tox. This is the medicated cooling pads with witch hazel that gonna provide you that cooling effect, and that will help you to ease the pain and that burning sensation. And this one is really helpful. Even the hospital, they gave me the one, but I also got the one from the Amazon. This is my second one, and I use this one a lot, and this gonna help you with all that soreness. Vaginal soreness will be continue, and it will be more hard when you go to the toilets and when you pass the urine or when you do the poop, because you have to put the strain and all the urines that will get your burning sensation on the stitches. So at that time you can use the Peri Bottle. This is the one that I use. This is also from the Frida Mom, and I get this one from the Amazon. Even the hospital will give you the one, but I think this one will be better. So what we can do is like we can just fill this bottle with a warm water. So we pass the urine, we can just put the warm water, and we can just do like this, and we can squeeze the warm water through the vagina. So it's gonna help you with that burning sensation, as well as it will clean your vaginal area, and it helps to reduce the chance of the infection. Fourth product that helps with the vaginal soreness is this Dermoplast. This is the over-the-counter pain spray. So you just have to spray this one on the vaginal area, and that's gonna help you with the pain. This is the pain medication in the spray form. So this is really the good one. And what you have to do is like just spray this on the vaginal area and then put the pads on, or you can put that ice pack I showed you before, or the cooling pads on the pad, and you are good to go, and this is gonna help you with the pain. So this is the product that even I used at the time of that vaginal soreness, and that really helped me a lot. And other thing I want to talk about the vaginal soreness is the constipation. So we're going to do the whole topic about the constipation later. If you have a constipation, because a lot of people will get the constipation after the delivery. If you have a constipation, you have to put the pressures during poop. So at that time, that strain will put the pressure on a stitch, and that gonna stretch your stitch, and you're gonna feel the soreness on your vaginal area. So even if you go through that constipation, it's better to talk with a provider to get some stool softener that will help with the constipation. So you can also use the over-the-counter medication like ibuprofen for the pain. So I use the ibuprofen. The hospital gave me the, I think around the 1000 milligram 3 times a day, I think. So you can also take the ibuprofens as the over-the-counter pain medications. So if after all of these comfort measures, the pain didn't subside, or you still feel a really bad pain or the vaginal soreness, you can talk to the provider for the further investigations, because it could be the sign of the infections. Let's talk about the another changes that happen to our body during the postpartum, and this is vaginal bleeding or discharge. Expect the vaginal bleeding or discharge as soon as the placenta is delivered. So once the baby is delivered, the placenta have to be delivered, and to deliver the placenta is normally attached to the uterus wall, and then during the time of the placenta delivery, it will detach from the uterus wall. At that time, it will leave the wound around the uterus wall. From that wall, you will get the bleeding, and you will experience the vaginal bleeding or the discharge. This vaginal discharge or bleeding is also known as lochia. And this lochia is divided into 3 stages. One is Lochia Rubra. So this is the red blood or bright red blood that we experience immediately after the delivery till day 3rd. The second one is Lochia Serosa, and in this stage that red blood is changed into the brownish pink color, and this gonna last from day 4 to day 10 of the delivery. And the third stage is Lochia Alba. In this stage, that brownish pink color of discharge is changed into the white discharge, and that will start from day 11 to day 14 of the postpartum period. This discharge or bleeding, it feels exactly same as the menstrual blood flow, and it is exactly same like that. The vaginal bleeding will last till 3 to 6 weeks of the postpartum period. So it's normal to have a vaginal bleeding for a month or for 6 weeks. Even me, I had a bleeding till I think 5 weeks. If you are having a heavy bleeding or if your pads soak within an hour, you have to immediately contact your doctors because you may have a postpartum hemorrhage. So contact your doctor as soon as you experience a heavy blood flow. Let's move to the another changes that happen to our body during postpartum, and that is urine incontinence. In pregnancy, labor and the vaginal birth, the muscles that support the bladder that we call the pelvic floor muscles will get injured or stretched, which will result into the leakage or the dripping of the urine. It happens more when you sneeze, laugh or cough because these activities will put the pressure on your bladder. Let's talk about how to deal with the urine incontinence. And number 1 is diet and exercise. So in diet, basically there is a lot of food that will irritate your bladder, such as the drink that contain caffeines and the spicy foods that will irritate the bladder. Try to avoid this kind of food as much as you can. And the other one is exercise, and there is a lot of pelvic floor exercise such as Kegels exercise that is specifically for the bladder. So this exercise will help you to strengthen or make the muscles stronger, and that will help you with the urine incontinence. Another point is wear the sanitary pad because you're going to experience the leakage of the urine, so that's why it's better to put the sanitary pads on. And there is no any specific treatment for the urine incontinence because it took time to heal your body. So this whole 6 weeks postpartum is, I would like to say, this is just a healing process. So it will take time to get your muscle stronger, so it will heal by the time. Let's talk about the another changes that happen during postpartum, and this is constipation and hemorrhoids. Personally, I would like to say that this is the most painful changes that happen to me in this postpartum life. There is a lot of hormonal changes that happen during this postpartum period that leads to the constipation because that hormonal changes will affect the digestive system. There is also the several factors that will lead to the constipations such as diet change and the dehydration. So you will get the pain medication at that time, and that also causes the constipation. And the other factor that causes the constipation, I would like to say, is like you will have a less movement because of the pains, so your movement will be restricted and this will lead to the constipations. So once you get the constipation, please try to avoid the strain because it's gonna put pressure on your stitches, and that will lead you the pain and the vaginal soreness as we talked as before. Continuous strain during the constipations will lead to the hemorrhoids. During hemorrhoids, you will feel the pain or soreness in the anal regions, and you will experience some of the bleedings, and likewise, and you will feel some lump on the anus area, and this is the sign and symptoms of the hemorrhoids. So now the question is how to deal with constipation or hemorrhoids. The first one is diet. So try to eat high fiber diets such as green vegetables, lentils and whole wheat breads and fruits that will help with the constipations, and try to drink a lot of water. So other one is try to ambulate as much as you can because the sitting in the same position for a long time will put the pressure on your anus, and that will lead to the constipation or the hemorrhoid. Fourth one is you can take the stool softener. So talk to the provider regarding stool softener. And the other factor that will help with the constipation and hemorrhoid is try to sit on the warm water, that is also called the sitz bath. So you can just sit in the warm water for 10 to 15 minutes for like 4 to 5 times a day. It will help with the constipation and the hemorrhoids. With the constipation or the hemorrhoids, you're gonna feel the burning and the pain on your anus area. As I showed you before, that Hazel pads that will also help with that pain and the soreness on the anus. So you can put that pad, the Hazel pads over your pad, and then you can just put the pad on. So that also helps with the burning sensation and pain around the anus. If your hemorrhoid is getting worse or didn't improve after all of these measures, you can talk with your provider. So let's talk about the another changes that happen during the postpartum, and this is the tender breast or breast engorgement. Tender breast is happen when your breast is full with milk. So this is generally happen after a few days of the delivery. The way to deal with the tender breast is try to breastfeed your baby as much as you can and try to empty that breast. Let's talk about how to deal with tender breast. So tender breast is all about the fullness of breast with breast milk. To ease the breast fullness or the breast pain, try to squeeze the milk as much as you can. So if you are a breastfeeding mother, the best way to express the milk is try to feed your baby as much as you can. And if you are not a breastfeeding mother, try to squeeze the milk with your hand. Whenever you have a tender breast or the full breast, it's really hard to get milk sometimes. So in that case, what we can do is like we can apply the hot compress. This is the one I use, and I get this one from the Amazon. And this we can use this as a hot compress and a cold compress too. So before breastfeeding or before you express the milk, just warm this pad and put it over the breast like this, and this will help to secrete your milk. And after the breastfeeding or after you express that milk, you're gonna feel some pain, and to ease that pain you can put this one on the freezer for a couple of minutes and put it on the breast. That will help to relieve the pain. And there is another thing that will help with the tender breast is this milk massager. This is really helpful, that even I use a lot. What we can do is like this is just like a vibrator machine. So you can just turn it on and it will vibrate, and just try to rub around the breast like this, and it will help to clear the dogs and it will help to express the milk. The other thing we can do is wear the supportive bra to support your breast. You can also take the over-the-counter pain medication if you experience the pain, and if the pain is not subside even after you take the medication, you can contact your provider. The other thing I would like to add is the nursing pad, and sometimes you may experience the leakage of the milk, and in that case what we can do is like this is just a pad. You can, and it have a sticker over here, and you can attach this one on your bra, and all the leaked or leakage milk will soak in this pad, and this will really helpful. Let's talk about the another changes that happen during the postpartum, and this is postpartum mood changes. After having baby, a lot of the women experience the mood changes, emotional breakdown. Around 85% of the women experience the mood changes and the emotional changes during postpartum period. And there is a lot of mixed feeling happen in this phase, like you will get the limited sleep and meeting the need of the newborn babies, and like new parenthood will kind of overwhelming for you. That will include the mood swings that will lead to the sad, to the joy. You just feel the kind of mixed feelings. So it's not like that you only gonna feel sad. Sometimes you enjoy that moment, and at the same time you're gonna feel anxious and sadness. So that kind of changes happen in this phase. Baby blue is the common mood changes that happen during the postpartum periods, and the symptoms include the mood swings. You're gonna cry for no reason, and the anxiety, and you're gonna have a difficulty in sleeping, and this is the sign and symptom of the baby blues, and this will usually subside within 2 weeks. So how we're gonna deal with the baby blue is take your time and share your feelings with your partners or friend, whoever you feel comfortable with, and this will help with the baby blues. There is a lot of things to talk about regarding the baby blues, and I'm gonna make the separate videos on this topic later. If your baby blues didn't subside within 2 weeks, or if you experience a severe mood swings, anxiety, sadness, it may lead to the postpartum depression. Postpartum depression, you will feel the anxiety, fear, sadness, and at the same time you will feel to harm yourself or harm the baby. And if you feel like this kind of symptoms, please try to get help or contact your provider as soon as possible. So that's it about all the changes that happen during the postpartum period. And now let's talk about the another topic, that is postpartum checkup. This is a part of the postpartum care. In this appointment, the doctor will talk about the mood and the emotional changes that happen during the postpartum periods, and he will talk you about the birth control methods, about the baby handling, baby care, and the feeding process. And the doctor will also do the physical examination that will include your vitals. He will take your blood pressures to make sure your blood pressure is within a normal range, and they will also check your cervix to make sure that your cervix is healing well. This is all happened during your postpartum checkup, and if you have any other concern or if you're facing any problem, you can contact your doctor anytime. This is pretty much all about the postpartum care. I will see you in the next video with another content. Till then, bye bye. Have a good day.